Good afternoon, everyone. Good afternoon, Vanessa, and thank you for having us today. Ladies and gentlemen, you're all welcome to this webinar titled Data, a Currency for Evidence-Based Healthcare Development, How to Optimize the Generation, Collection, and Exploitation of Data. So I'm Dr. Vera Kum, and I'll be the moderator for this afternoon. Joining me to dissect and give us more insights on this important topic for this afternoon in the next 1 hour 30 minutes, I have 3 gentlemen who are experts in their different fields and who are ready to explain to us and to share their expertise with us on this important topic, so that at the end of the day, before we leave, by the time we leave this webinar, we should have succeeded in gaining more insights and more knowledge about the necessity of data collection, generation, and development in sub-Saharan Africa, and why not in Cameroon? These days, it is very important when we talk about research, it is very important. We talk about data collection, we talk about data generation, and above all, we talk about the exploitation of data. So it is a very timely discussion, ladies and gentlemen, at a time when technology has taken a greater toll on us, at a time when technology is gradually eating into our society, at a time when we all know the importance of technology in terms of research, at a time when data plays a key role when we talk about research. In healthcare, we cannot go silent without talking about the importance of data collection. So that is why this afternoon we shall be laying more emphasis on data collection, data generation, and data exploitation that can help us in our different fields of research. So I would like to introduce the 3 gentlemen who have accepted to share their expertise with us. So first, I would like to start with Professor Joseph Payen, who is a professor of biostatistics and the John D. Cameron Endowed Chair in the Genetics Determinants of Chronic Diseases at the Department of McMaster University. So Prof holds a master's and a PhD, a BSc and a master's degree from the University of Guelph. He also holds a PhD in biostatistics from the University of Toronto, Canada. Prior to moving to McMaster University, he was a senior scientist in the Research Institute of the Hospital for Sick Children in Toronto, and an associate professor of biostatistics at the Dela School of Public Health, as well as the Institute of Health Policy Management and Evaluation at the University of Toronto. His research interests include methodology, development, and applications, focusing more on evidence synthesis in healthcare with application to public health sciences and clinical medicine. He has interest in integrative statistical and data science methods for high-dimensional data with emphasis on multi-omics, environmental, and clinical data. So, Prof, good afternoon, and you're welcome to the Dennis and Lenora Faurissi Foundation.
Thank you very much.
Okay. My next panelist, ladies and gentlemen, is none other than Justus Ashaba, who is an information systems specialist with over 9 years of experience in design and implementation of digital health solutions and parallel experience in implementing, monitoring, evaluation, and data use strategies in the health sector. Justus holds a BSc and MSc in Information Systems from the Makerere University, a postgraduate diploma in Monitoring and Evaluation from Uganda Management Institute, a professional development certificate in Monitoring and Evaluation in Global Health from the University of Washington, and is currently pursuing a Master's of Public Health at Uganda Christian University. Justus is a researcher at the Makerere University, Health Informatics Research Group, and a Monitoring and Evaluation Officer at AMREF Health Africa in Uganda. He has previously served as a Program Officer, Monitoring and Evaluation at Africa Centers for Disease Control and Prevention, and the Laboratory Information Systems Mentor at Uganda Ministry of Health, National Health Laboratory, and Diagnostic Service Departments. Justus has participated in other various collaborations in supporting information systems, digital health, information and communication technology for development, monitoring and evaluation, and research in both private, government, and non-governmental institutions. Its research interest, ladies and gentlemen, focuses on the interplay of information systems and research-based management. Justus, good afternoon, and we're happy to have you.
Thank you, everyone. Good afternoon. Nice to have you.
Thank you. So our last panelist for the day, ladies and gentlemen, is none other than Wilfred Gwa, who is an epidemiologist, microbiologist, and a research fellow at the Denis Alenora Fauretia Foundation. He's also the founding director of EpiGuida, a consultancy organization in epidemiology and research. He has 8 years of experience working as an epidemiologist and a microbiologist. Wilfred started his career as a microbiologist and laboratory technician in Cameroon and has worked with Médecins Sans Frontières in different countries, including Mauritania, Guinea, DRC, Congo, and Zimbabwe. He is skilled in data analysis, map creation, mobile data collection, monitoring and evaluation, and more statistical packages. Wilfred has a particular passion in contributing to the growth of his country, Cameroon, Africa, and the world at large through research. Wilfred, good afternoon and nice to have you.
Thank you very much.
Okay. So everyone, the moment has come for us to get pertinent insights about this interesting topic today. So before we get into the crux of the matter, I would like to tease our minds, my humble panelists, to give us your general view about the topic, data, a currency for evidence-based healthcare development. What is that thing that comes to your mind when we talk about data collection, generation, and exploitation in the world today? Thank you. I would like to go first with Prof. So tell us what he thinks about the topic for today. Prof, over to you.
Thank you very much once again, and it's a pleasure to be here. Thank you for the invitation to participate in this very interesting panel discussion. Yes, so I actually like the topic that is given to this session. I want to dissect it into, if I may, into 3 pieces. So at the raw material is data. So it's all about data, it's raw material. And the outcomes that we want to achieve, or the objective, is to practice evidence-based healthcare. So that evidence-based healthcare is by itself is really a goal, and what we want to achieve. And we have raw data, the ingredient is data. And then the remaining part of the topic, the way I see it, is about processes we have to follow. So the generation, collection, exploitation, analysis, presentation, all this is our approach. Taking that raw material into something that makes sense with the hope of practicing evidence-based healthcare. So to me, this is very important to see it that way, these 3 aspects to the title. Obviously, we'll go into details and follow-up questions. If I may just say a little bit about the second one, which is the evidence-based healthcare. As we
Okay.
all know, evidence-based healthcare or evidence-based medicine has been around for a while. So I'll probably come back, since you asked me just to be brief. This is how I see it. These three important components, if you will: data, processes, approaches, methods, with the objective of practicing evidence-based healthcare.
All right. Thank you so much, Prof.
No problem.
Justus, what is your take on this topic for this afternoon, please?
Yes, thank you everyone for organizing and for attending today's webinar. So as the topic mentions, we realize the trend is now to achieve evidence-based results in the healthcare sector. And of course, when you look at the evidence that is necessary, when you look at the whole cascade in the healthcare provision processes, there would be evidence comes back to what we are calling data, because in anything that we may want to prove, there has to be a decision to be made, and that decision is always based on information, of which the information comes out of the different data sets that may be collected at different points. So as Prof mentioned, data is looked at as a raw material in this case. And of course, we are trying to see what do we go through, or what do we need to do in order to utilize it for the necessary evidence that we need for better decisions in the healthcare sector. So I believe as we move on, we will then get to the details of the data, the processes, and the evidence healthcare. Thank you.
All right, thank you so much, Justus. Wilfred, over to you, please.
Thank you very much. It's a great pleasure for me to be a part of this discussion, especially in the presence of very strong colleagues, Prof. and Justus. To me, the topics are quite an interesting one in the sense that it's actually brings into light my past experiences using data as a tool to influence decision making. So it will be an opportunity for us to discuss experiences and share experiences on how we can use data to make informed decisions that can change a lot of things in the context of Africa and the world large. Thank you.
All right, thank you so much, Justus. I would like to stay back with you, Justus, to tell us, now we are in the digital age. We've gone past the analog. Now we're talking about digitalization, especially in the healthcare sector. So what are some of the benefits of the digital healthcare systems over some traditional paper-based records?
Yeah, thank you very much. So when we talk of digital, first of all, we are trying to make portable or even easy to handle. There would be paper-based records, paper-based procedures, paper-based guidelines into portable, what I can call soft copy options that we carry on easily on our gadgets, on our systems, on our networks. So when we digitalize that whole process, or even some of the components of the processes we go through to provide healthcare, we are making the resource, which we are calling data or even information, we are making it portable and easy to handle. So instead of having it in the paper formats, as you mentioned, which may be really difficult to handle, difficult to keep, very delicate, we are now making this information easy to handle in a way that then it can be easily shareable, it can be easily commanded. You see, when we digitalize information or even processes, we are able to have a command on those processes. And unlike when everything is on paper and we are limited on who can touch it, who can access this digital information or digital processes, we are able to easily access. We can easily command. Now that's when the language of programming comes in. So we are able to program that data and utilize it in any way. If it is to be shared with different stakeholders, then that can easily be commanded on digital data, not the paper-based data. And of course, as we move on, when we have made the data easy to handle, easy to share, we have commanded it, then it becomes very easy again to make decisions, because this information will be accessible and everywhere whenever it's needed. So I see digital health and digitizing this whole process brings many benefits in a way that we can easily handle the information, but also that information will always be available when we need it and in any format and everywhere we need. Yeah, my colleagues can add on that.
All right, thank you. Wilfred, what are some of the benefits of digital healthcare systems over the traditional based records? You've been into research for over 8 years. What are some of the benefits that you've encountered going digitally?
Thank you very much for this interesting question. I would like to, first of all, start by saying that digital health, to try to break it down in a broader term, it encompasses the utilization of information, communication, and electronic technologies for the improvement of health and providing healthcare. So in terms of the benefits, there are quite a number of benefits that the digitalization of healthcare systems has brought. So that's issue of accuracy when it comes to data. If you look at, when we talk of accuracy and up-to-date data, if you look at paper-based systems, you see a very common problem during when years are changing from one year to the other with dates. You see, people tend to say, maybe a lot of you have made that error this year by saying 2022 or 1st of January 2022. But digitized systems, you can control some of these areas by setting automatic dates to pick up dates. So you can control accuracy of data. It's also quick. So that's this digitized systems are faster in the sense that with paper-based systems, first someone has to take time to write this data, and then you have to build a system to collect this data. But with digital systems, it's faster because the data is entered directly into the system. And so besides being fast, it's also convenient in the sense that it's easier to type this data. Another thing is it's easy to share this data, as just mentioned. We have systems in research where the researcher is not on ground and you're working with a team, and with digitized systems, it's possible to share this information in such a way that all the participants that need to see this data can see it real time. And this can help to identify errors quickly, especially when we're talking in the context of research that can be corrected in the next day. So I give a particular experience like using maybe the Kobo tool, ComCare, where we have data collectors on ground. And every day we review this data and we're able to say, okay, these are the areas where you guys were strong. These are the areas where you're weak. In collecting this data the next day, you can make this kind of decision. But with paper-based systems, this is difficult to something that is difficult to achieve. And now we're talking more about privacy. With data collection systems. It's possible that someone can break into the office and pick up records from patients and disappear with it. But with digital systems, it's possible to put in passwords that are only available to key persons. And with that, it makes the data private and only persons who are permitted to access this data can access. So yeah, quite a lot. We can keep going and going, but the point that I want to make here, it's clear that digital systems are quite better than paper-based systems. But it's also very important to note that paper-based systems also have their place, depending on the setting where you find yourself. Thank you.
All right, thank you. So with that, you just helped to rekindle our minds that technology has actually done us something really, really good, because it now makes it easier for us to share data across the globe without necessarily being physically on ground. So would you say that digital healthcare, digital technologies in healthcare systems are safe and efficient? Wilfred?
Yeah, thank you very much. These questions that you always put the dependency clause there. It depends on how the systems are developed as well. But when the systems are developed accurately or well developed, then you can say they're safe, because most digital systems are coming up with a lot of the safety considerations already taken into place. So if you look at most of the digital systems that are available, in my experience, for data collection, like the Kobo Toolbox, the Comcare, there's so many. They have this component of keeping your data in a secured space where if you don't have access to, if you don't have passwords to access, you will not be able to access this data. Yeah. So in my opinion, I would say they are relatively safe. I've been using them for the past 8 years, and I've not had a situation where there's been a break where somebody had to access this data who is not permitted to have access to such data. Yeah.
All right, thank you so much. Justus, do you share same idea, Prof? Do you share same idea that digital healthcare systems are safe and efficient?
Yeah, Prof can go first.
All right, Prof.
Yes, I agree with what has been said, both in terms of benefit as well as some of potential challenges that we face when we work with digital data. But I think for me, digital or data-driven healthcare of the future will not avoid digital data collection. In fact, I mean, we can see our own life, how our life changed. Individual, for everything we do now, most of the things we do in one way or another depend on digital technology, right? So if we go back 15, 20 years, we did lots of things differently, using traditional approaches. So it's not an exception when you go into the future of healthcare. It will be digital. There will be challenges, but those challenges will be more understood over time, and appropriate measures will be taken. The challenge, as I said, in the African context, especially, not only Africa, in resource limited context, is more the infrastructure will be challenging, and we'll come back to those questions in other questions, and maybe I'll say more. But yes, in principle, I agree. The way forward is digital.
Okay, thank you so much. The way forward is digital. Justus, I would like to pick your mind to find out, do we have what it takes to get data and optimize storage? Yes, Prof and Wilfred have said digitalization is good, it's efficient, it is safe, but would you now say we have what it takes to get this data stored and optimized, especially in our African context?
Yeah, thank you very much. Of course, handling that, looking at, do we have what it takes? Yeah, it's a two-way status. Depending on the situation and the context, at some point I would say yes, because we've observed ongoing practices and technologies and growing trends where partners, ministries of health, where governments and its partners have come in to implement these digital health interventions, and they have been successful. We've seen trained personnel who bring on different skills and different thoughts to command the process of developing and implementing these technologies. We've seen the academia contributing. We've seen the health workers getting involved. So yes, we have what it takes, and it's evident that we've had successful interventions. Looking at the literature, we see a lot going on. And on the other hand, I would say we may be still lacking, considering that this digital health is dependent on technologies, of which technologies, as we might have observed over the years, these are tools that keep changing. The power of technology keeps changing. As we are here adopting technology A, there comes technology B that may be even more powerful. So I may say our healthcare settings may not be funded, may not be developed, may not have all that infrastructure that is up to the speed of how technology is moving on. So yes, we have what it takes, but we may not be responsive enough to the speed at which technology is, because as you mentioned, related to that is a security related issue. As you mentioned, yes, we see that the data is safe and secure, but depending on how the technology you are using is, it may be secure or not. So for example, if you're using a lower secure technology, then it means you will not have had what it takes to implement maybe a better secure technology. And that would always require continuous improvement. So with technology, we cannot say we are there, we have exhausted everything, because we see technology keeps changing. So what we have to appreciate is that it's a continuous improvement effort. So we achieve what we've set to achieve today, but tomorrow we set some other targets and work towards achieving them. Over.
All right, thank you so much, Justus. Now, I want to talk about finances in healthcare, and that keeps my mind worried as to, we're talking about data generation, we're talking about data collection, we're talking about data exploitation, and all of this takes finances. So who, in your opinion, Prof, should pay to get this data?
Thank you. This is a very important question. As you outlined, the whole process from collecting data all the way through analysis will be costly, potentially. It's not always costly, but it can be very costly. And who should pay? Well, it depends. I think the answer to that, it depends in terms of what type of data are we collecting and who wants the data, who benefits from the data. So we could think of just this small data that's collected by a clinician. Just they're curious, they want to know more about, their patients, and try to do some, research study. And graduate students may collect data, but really, based on this topic, we probably have in mind much bigger data at the various levels. So to me, the cost should be, in an ideal world, shared. By shared, I mean governments have responsibility to pay for data. Say, Ministry of Health has a responsibility. Funding bodies, they don't have to be in that country specifically. They could be from across the globe. If they're interested in that particular topic, healthcare topic that's being addressed, they could contribute to the private sector. So I think it has to be really a collaboration, a partnership across governments, private sectors, like, for example, pharmaceutical industries. Yes, they make so much money, but they have also a responsibility to help out in this process of collecting health data and managing it, as well as optimally analyzing it to generate evidence. So I think that's the model I think is a more collaborative or partnership. But again, it depends on the scale of the data. Is it a small data set, which is, specific to a small area, or is it big? We have seen this, for example, during COVID. COVID is a great example that affected the whole globe. So everyone came together to, share data. Everything costs. There's nothing for free. But I think that COVID-19 would be a good example. These partnerships that I have in mind was displayed clearly. Thank you.
Okay, thank you so much, Prof. Wilfred, you've been into data analysis, data collection for over 8 years. So who pays for this data collection and analysis? Do you do it out of your own pockets? Do you have support from donors, from governments, from NGOs? Who pays for the data?
Yeah, thank you very much for this very interesting question. And I think Prof has really elaborated on this. Yeah, the collection of data goes at different levels. And in summary, I would say the user should pay. And the user now varies from one level to the other. If the governments are making use of data to make decisions on their healthcare systems, to track diseases and make decisions, then the government should pay for more robust systems to collect data at a national level. If you go down to NGOs come to do particular projects within countries, and most of the times it's as part of the government, or they can do parallel projects. In that case, they also put in systems to collect their data, and they have to pay for it. And we go down to even smaller levels. Students might want to collect data for his thesis, like Prof said. And although they are also free tools, but depending on the complexity, he might also have to pay for the data he or she wants to collect for that study. So it's really a dependency question. It depends on what the user that is involved here, and such users have to pay for the data. Thank you.
All right, thank you. So just as this share same idea with the other two panelists on the user should actually pay for the data.
Yes, that's very true. Of course, as colleagues have mentioned, the users are again not only the patient, not only the person seeking healthcare, but a wide range of users or the stakeholders. So what they are mentioning is stakeholders, and all stakeholders should really support these processes and fund these processes of collecting the data, which is very true. And maybe what I can add is that in all this, when we are looking at funding these processes of having the data available, it will always be a dilemma if we try to separate data availability and collection from the general health packages that our governments provide, or even looking at the different funding mechanisms that our different countries apply. So it's a dilemma if we try to look at who funds the data generation and the data utilization. So in a better way, we would then say, let this data generation, let this data manipulation and all these processes of using it be part of the healthcare package. We've seen ministries of health and all other funding partners are funding interventions to make sure there is universal healthcare in all our countries. So we should make sure that this element of having the data available for use is part of the whole programming, so that when we say we are funding HIV we are funding tuberculosis, malaria, then the components of data collection and utilization are also embedded in funding mechanism being sought by each government or each partner, whoever is supporting the interventions in our country. Yeah, over.
All right, thank you so much, Justus. Ladies and gentlemen, again, we are talking about data, the currency for evidence-based healthcare development, how to optimize the generation, collection, and exploitation of data. So I would like to remind our audience that we have the chat box. You can send in your questions because very soon we will open up for questions and answers. Also, we have translation ongoing. Those who are French speaking, please check in the chat so you see how to get connected to either French or English, depending on your language of preference. So you can drop your questions in the chat box, and when it's time, I will go through the questions for our panelists to provide some more insight. So I'll come back, ladies and gentlemen, to Wilfred to find out how can digital technology be implemented to enhance universal healthcare access in resource-limited settings, especially in Africa.
Yeah, thank you very much. Again, this is yet another very interesting question. I would look at this under some key guiding principles. So the first, I think, is that in Africa, countries have to acknowledge that the institutionalization of digital health in the national health system requires a decision and commitment by the countries. So first, countries have to commit to the fact that they want to use digital health as a tool to collect information and revive their health systems. And then secondly, it is important to recognize for countries, or African countries, to recognize that the successful implementation of digital health systems require an integrated strategy. So there must be discussions with all the users in country to ensure that the right systems are chosen that are well adapted to a particular context. Because a digital health tool that would function well in Cameroon might not be the best, might not function in a similar manner in another country like Zimbabwe. So this integrated approach to implement the systems essential to the successful implementation of these technologies. The third is that the appropriate tools should be chosen based on an evaluation of the context. We have seen situations where digital systems have been put in certain contexts and they have not worked properly because the choice of the tool was not it's not something that was adapted to in the context. We have had situations where tools had been implemented and people are expected to start using without even a proper pilot of these tools to learn from the errors from there to better adapt these tools to function properly. And the fourth point that I would like to discuss is that it's important to recognize the urgent needs and to address the major impediments faced within countries when implementing digital technologies. And these impediments are things that we're going to discuss in future questions within this discussion. My colleagues can add more to this. Thank you.
All right, thank you so much, Wilfred. And Prof, I would like to come back to you to find out if there are some emerging trends and opportunities for digital health, especially in Africa.
I would say yes. I think with technology now, as technologies advance, Remember, we talked about cost earlier, but even as technologies advance, the cost is going down fairly quickly. I can give you an example from genomics. One of the things that over the years I've been involved with is genomics research, where really the data tends to be very, very big. So a clinician could take a sample, small sample, blood or other sample, and may want to profile the whole genomic information for every individual. Back 15 years ago, maybe one person or generating data on just one individual could cost about $1,000 US. Now that cost has come down substantially. So I think in the African context, what's very important now is this trend that technology is advancing very quickly and prices have come down. So I see that trend in some countries that they are trying to capture things like genomic information. Also, electronic health record or electronic medical record is being tested and implemented in different countries in Africa. So that's a good trend. So these are all digital. And the opportunities are always there. As I mentioned earlier, this can be enhanced by, forming collaboration with colleagues, not necessarily all in Africa, first within Africa. That would be ideal because we have something that we share in common in terms of the nature of the health situation that affects us as a continent and also beyond our continent. So I think just to summarize it, yes, there are emerging trends because of advancing technologies that made it possible to generate data, and the opportunities are also beyond the continent in terms of, forming consortium like in genomics, for example. Some of you may know that there is something called H3 Africa, which is a consortium that involves not only African researchers and policymakers, but also others across the globe. So I think these are very exciting times, and these are very potentially helpful opportunities for the future of healthcare in Africa. Thank you.
All right, Prof. Thank you so much. Justus, I'd like to come back with you to share us your own experience regarding digital health, especially in resource-limited settings. Over to you, Justus.
Yeah, thank you very much. So we are looking at how best can we implement these digital health interventions, especially in resource-limited settings. Yeah, our colleague Wilfred mentioned some of the strategies, and what I would like to add, for example, when you set the pace that I would like to implement ABCD strategies, which are digital strategies, but we know the resources are not enough, the environment may not be favorable. So I think what is key in that situation is making sure that we have a results-based mind so that we then keep focused on the results, what we need to achieve. So what we need to achieve with such interventions needs to already be clear from the start, so that then it helps us to use our little resources efficiently. Yes, so in that way, it will be helping us to be careful of each step that we take. For example, if we are still in the planning processes of implementing the digital health intervention, and we have the results in mind, or where we need to be in mind, it will always help us to prioritize. So the little resources we have, we prioritize to any strategy, any direction that will help us reach where we want to be. So maybe in summary, in case I've talked a lot on that or may not made it clear, is that we need to have a results-based mind as we implement, even in such limited resource environments.
All right. Thank you so much. And I would like to stay with Wilfred to tell us some of the perceived social and cultural willingnesses of the population, especially in Sub-Saharan Africa, towards digital health. You've been working a lot with digital health issues as you're carrying on research in Africa, especially when you work with Médecins Sans Frontières in different countries, Zimbabwe, Mauritania, and Guinea. What are some of the perceived social and cultural willingnesses that this population in Sub-Saharan Africa have towards the digital health? Thank you.
Yeah, thank you very much. I would like to say that this really vary widely from one country to the other. But I'll give a very interesting situation that I faced in a very remote area in DRC, in Masisi, if any of you happen to know it. It's really a very remote area. And we were using mobile phones to collect data on why people go to health facilities late. And talking about this issue of not using the integrated approach or understanding the kind of tools to use before going to implement them, we use mobile phones to collect data without having. So when we went to the villages and we're collecting data, we wanted to take some pictures. And when we took out smartphones, it was really a problem. We had a lot of resistance from the community. There were people who had not seen smartphones in this era, and they were afraid. So we were like, what are you doing? Why are you taking these pictures? You're putting me into the phone, and those kind of things. So it was really a scary situation when it's not well explained to persons. So this cultural situation is my comment. But in other contexts, it's something that is well appreciated. People want to share, want you to show they want to show the problems that they have. Like, especially in the rural cities in Harare, Zimbabwe, when we're conducting some studies on the sanitary conditions, people were happy for you to take pictures of how dirty the environments are, so that the governments could actually see the situation and try to solve their problems. So these aspects of culture really there's a lot of diversity as you move from one context to another. But I think the guiding principle around there is that if you're using the digital technology, first you have to understand the context that you're using these tools there, understand the possible challenges that you can face, and integrate these challenges as part of the consent or the explanation to the participants that you'll be collecting this data from. Yeah, thank you.
Okay. All right, thank you so much. I share a similar experience with you in one rural area in Cameroon, Mukundange. When I went there for data collection on governance, a survey that we did at the CAFO Policy Institute of the Denis and Leonora Vorete Foundation, and we met with so much resistance from the locals. They were like, you want to implicate them. The minute we brought out the tablets to some sort of go through the set of questions we had, take a few pictures, get some audios, they felt laid back. We had so much resistance because it felt like we're getting into their privacy, we wanted to implicate them, but we had to take our time to explain to them the importance of what we're actually doing. Now, Justus, is it the same? Do you meet the same cultural shocks in Uganda, especially having worked in different settings in Uganda? Do you meet with the same cultural shocks from your natives? Justus, can you unmute yourself?
Yeah, very true. This is not really, in the different context, you realize there are those limitations and people fear the power of data and sometimes tend to hide or even make it not flow as it would be. Yeah, so that's very true and it's common in the different countries that we've supported. Yeah, and maybe what I can add on is that we are looking at what are some of those limitations that are failing us to develop such data culture and utilizing the data in the work we do to provide healthcare services. Of course, the limitations are many, but key of them, from experience, I've noted the capacity building that we go through as health workers or as human resources for health. I think data utilization, data collection from the past, it has not been part of the curriculum or even training or even part of the mentorships that are ongoing. So we are coming from a generation where data has not been really something utilized and easy to access. And the generations have not trained and even shaped the mind of health workers to be evidence-based or even be data-driven. So with that background, we realize we still have some limitations for some of the players in the health sector to be data-minded or data-driven. But good enough, there are efforts, as we've seen, they are changing trends, and everyone is coming on board to realize the importance of being data-driven, evidence-based. So we believe with time, if the capacity building aspects can cater for making the trainees or the human resource understand the importance of being data-driven, then such limitations will always go away. But also in addition, we've seen limitations at the national and the continental levels, where you find governments may have reasons to make sure some data is not fully available, or even utilized beyond borders. Yet in public health, you realize sometimes this data has to be shareable for it to be meaningful and utilized. But some political or even other social factors, as we've seen, that are government relationship based, have also tried to limit this trend of utilizing the data. Over.
Thank you so much. One last question, Prof, to find out what is keeping us back, taking into consideration the different health systemic problems, the different ethical problems, as well as political and legal regulations that we face as challenges in collecting data. Over to you, Prof.
Thank you very much. This is again another very relevant and important question that we need to address. My background is more from the analysis side. I'm a statistician by training. But all my life, I could say after graduate school, I live with data. So data comes to me from many angles, from different groups, individuals. So what I have learned over the years is data generation is becoming much easier, as I mentioned this before, just mainly due to advance in technology. What to me is becoming a bottleneck, or what's lagging, is how to optimally analyze data that are available from various sources. Some argue that data is the oil of the 21st century. So oil, what we know, was made. Some countries were rich, but now some say data is an oil. I would argue just the same way oil needs to be refined to be used. Data, unless it is optimally used, would not help us much. So it's not going to be easy. It has to be a team approach, the subject matter expertise, the computational experts, epidemiologists, statisticians, many other people together, and social science as well, should work together to optimally analyze this data. When that happens, I think we'll benefit from the potential of data. In the context of Africa, the main problem still is trained what we now call data scientists. We have few, but we have a long way to go. In this part of the world where I live now, universities are rushing to create data science programs, train data scientists. In our continent, in Africa, if that doesn't happen, we may have data around us, but we'll be sitting idly and will not be used to create new knowledge and innovation in healthcare. Thank you.
All right, thank you so much. If there's one thing I picked from your last intervention, Prof, is there is the need to train data scientists so that the data that we collect does not lie idle and by and large goes obsolete without proper use of this data. So ladies and gentlemen, we're gradually coming to the end of our discussion, but we cannot end this discussion without getting the minds of our wonderful audience. So, two things. If you want to ask a question or share an observation or share your own opinion regarding this very important topic on data, you can either raise your hand or you drop your questions in the chat box. So with that said, we have a few questions in our chat box. I will just go through them one after the other. And our panelists, you can pick and choose which of them you feel more comfortable shedding more light on. So from Wika Shiffan, he wants to find out, it is difficult to obtain cost and expenditure data, especially from the government and government healthcare facilities. What can be done to break down this barrier, most especially for students seeking to carry out research in this area? Who can shed more light on it? Wilfred, Justus, or Joseph?
Yeah, I can talk on it a little bit, and then my colleagues can add.
Thank you.
I think it's always been difficult to get data, but difficulty also most of the times comes with approach. So if you want to get data easily, then you must respect the data laws, I put that in quotes, that are available in the country. If you're a student and you want to obtain data for a health facility, first you want to make sure that you have all the ethical documents that are necessary for you to obtain this, to collect this data in the first place. And even when you've passed through an ethical review board, it's also important to have administrative authorization in the area where you're going to collect that data. And in the context of Cameroon, it might be different in other countries. Even if when you have ethical approval, you want to talk to the regional delegates, regional authorization, you want to have the district authorization, and then you even want to have the health facility authorization before you go to collect that data. When you have all this authorization, then it might be easy for you to get that data. And then there's also, besides having all this necessary documents, there's also the aspect of your attitude when you go to demand this data from those who are collecting this data in the field. So sometimes if you have all this authorization and you go and you're not humble talking to these persons, it might be very challenging for them to provide you this data. So when you put all these things together, I think it can make your life. It's not always 100% successful if you put this together. Sometimes it's just difficult, but in most cases, when you have all these things put together, you will have access to data. Thank you.
Okay, thank you so much, Wilfred, for giving us that insight. So it is very important to get clearances at different levels that you as a researcher, you deem necessary. If you're looking at a health facility, it is important to get clearance from the hospital administrator or whosoever is in charge of that setting as need may be. I'll take on the next question from Meba. He says, one of the issues.
Before we go to the next question. Yeah.
Yes, please, Justus.
Yeah, I really agree with the participant. Yes, we are talking of data, but the focus here is on cost or expenditure data. And it's very true. This data is really never easy to get. And what I see that makes it difficult to get, you can realize that cost and expenditure and money used to finance the health sector, this is data that is available in different stakeholders. For example, in a national scenario, you realize funding of health services is done by different partners. The government may be funding, development partners may be funding. And when it comes to managing the funding in the country, you have the lawmakers who may be deciding on which budget goes where. You have the ministries of finance who really manage that process of disbursing the money into the health care facilities. So you realize there are very many players involved. And even when you focus on a specific health facility or even a specific sector, that funding and the cost and the money involved comes from different pipelines. There's government money, there's money from private sector who may fund some interests, there's money from international partners. So you realize these many channels may not be easy to manage for a basic system that has even not put straight data management systems. So the challenge is really big. But now coming to the solution, what do we need to do and what can we do? I think research has a great role to do here. If we can have more researchers bring out this problem clearly and show that it's a big problem limiting more other innovations to come on board, then governments can appreciate the problem and put in place some solutions to have that data well managed and available easily. Over.
All right, thank you so much, Justus, for shedding more light on that. Okay, we go on to our next question from Meba. He says, one of the issues is so far why some stakeholders don't find data collection a beneficial action. How to convince, for example, a farmer to collect data is an issue. Why then are some users reluctant to share data? So, Wilfred, why are some users reluctant to share data? From your experience, based on your experience on the field.
Yeah, I would say sometimes people fear exposure of their work, in the sense that I'll give a very clear example of a situation we faced in Guinea, Conakry, where people were, should I use the word, tweaking data to get funding. And so because of this manipulation of their data, it was difficult for them to share when they know that you coming in as an analyst might show some of the problems that are not really existing in the situation. And so in such situations, people might be not wanting to share their data. Another thing where you face resistance in data is that you see international organizations sometimes come with big money and they actually pay health facility, head of health centers, a lot of money for providing information. And so other users who come in would need this information who are not paying this kind of money, sometimes face a lot of challenges, because you hear people saying, oh, if the WHO is paying this amount of money for me to provide this data, you're asking the same data for free. And sometimes it brings these challenges. So there are a lot of things that are, there are a lot of political challenges that are going on in the field that makes sharing of data quite challenging. Yeah, thank you.
All right, thank you so much, Wilfred. I will take another question from Jumia Chinyo Eyong. He says, good afternoon, I'm happy to be here. I would like Mr. Justus Ashaba to please give the importance of the data revenue information he mentioned, because I believe if implemented, it will greatly help in the collection of healthcare data. So Justus, this question is directed to you. Thank you.
Okay, thank you very much. When you look at data on revenue, okay, it says, please give the importance of the data revenue information, because I believe if implemented, it will greatly help. Yeah. So we are looking at the healthcare system in each of the countries where we are. And of course, as we saw in the previous discussion, these healthcare mechanisms are funded. They have to be funded. And now revenue here, we are talking of what revenue comes into the health sectors. So that information about the revenue is, I'm thinking that's what I've interpreted that the question is about. So one of the importance of having that information clear and available, of course, would be for accountability purposes, because whoever is implementing in the health sector, whoever is really using this provided for healthcare financing has to be accountable to the public or even to the section of the beneficiaries. So it would be important that this data is available for accountability. But beyond that, besides accountability, even for programming purposes, if we know how much has been put in place or has been spent to achieve a specific amount of result in the healthcare context, then we should be able to project and know how much resources we need if we are to either replicate the intervention or if we are to do another intervention of that same magnitude. So it's very important for planning, surely. So I believe beyond accountability, we can also use this information for planning. But also, as our colleagues here mentioned, they are good in statistics, they are good in analysis. When that data is available and it can be projected to analysis models, we can learn some insights. We may not even have any question to ask, but the moment we run this data into statistical models and run some analysis, then we are able to learn some insights and have some new knowledge available. We can discover some trends out of the data, and those trends can even guide programming or even policy making. So those are some of the benefits I think such data would have to the healthcare sector.
All right. Thank you so much, Justus. I'll take the next question from Frank Wanda. He says, good afternoon to all. Question for all panelists. What do you think is the most decisive factor in enabling the implementation of digital health in a country? The political will of the government, the maturity of the health system, and the technical platform of health centers or community involvement. Thank you. So Prof, please, can you go first? So what do you think is the most decisive factor in enabling the implementation of digital health in a country? Is it the will of the government, or it is the maturity of the health systems and the technical platforms?
I would say all of them, but in terms of priority or which one is the most important, I think it's the political will. As the saying goes, if there is a will, there is a way. So if a government wants to change the system, they may not be able to change it drastically in a short period of time, but with good partnership with others, they can make a huge progress. So I think the willingness comes first to me.
All right, thank you.
They will get the others. The others to me are byproduct, like the technical platform. And then when we have that, the healthcare system as a whole will mature over time. So I would put willingness first.
All right, thank you. Justus, Wilfred, do you share the same idea like Prof?
Thank you. I would really be in line with what Prof mentioned, because when I look at all these factors, the maturity of the healthcare system, the technical platform of the health centers, community involvement, when you look at those three factors, in fact, they can all be, or they can grow as a result of implementing digital health. However, when you look at the political will, it remains as the input into all of them. Yeah, the political will is really at the center of it all, considering that even in most of our nations in Africa, the healthcare system is a mandate of the government. We've seen that government is the one powering most of the healthcare services. So the political will here is very key. And when it's positive, then all these other factors will grow. Thank you.
Okay, thank you so much. Next question is, in my village in Yanchang, Mamfe Center of the Southwest region in Cameroon, bringing out tools like smartphones will be a very big problem to the inhabitants there. So how can someone carrying out data collection or doing research when his or her source is shying away from such? Just a brief background to Justus and Joseph. The Southwest region, or Mamfe in particular, is one of those hard-hit Anglophone regions that is going through the insurgency. So security happens to be a key challenge. So Jumia wants to find out, operating under this scenario where security is a very huge challenge, how do you go about carrying out research when your primary audience or target shies away from attending to you? So Wilfred, the son of the soil, please, can you go first before we break on Justus and Joseph?
Yeah, that's a very interesting question, and it's a very important one. I think we during this discussion, we had mentioned that it's very important to understand the context in which you want to implement any system, especially data health system. So already, if the understanding is that this is something that is going to be difficult, then it might not be appropriate to use a digital health system like a mobile phone in such a situation. And that is why in one of my previous discussions, I did highlight the fact that although digital health systems have advantages, and they've come with a lot of advantages, but it does not take out the use of paper-based systems. Paper-based systems, they have their place, and in some situations, and in most situations, rather, you can use them interchangeably. So, in such a situation, first, your security really is important, and in my years of experience, I've worked in similar contexts in DRC, and we went for paper-based systems to avoid such situations. So understand your context and choose the appropriate tool. In summary, that is what I would say.
All right, thank you, Justus. Any thought on that?
Yeah, thank you. I believe in such a difficult context, contacting the different stakeholders and engaging whoever is responsible in such a jurisdiction is very important. So before you approach the community where your data is, you may consider, first of all, approaching the high-level responsible offices and explain your approach, explain your importance of going to collect that data. And maybe if you get the support from higher offices, they can guide very well on how better to approach that, considering that they will even maybe give you the best methods, the alternatives you could use. As Wilfred mentioned, it's not only digital collection options that are available. There may be other interventions that can be utilized in such context. Over.
All right, Prof, any thought on that, please?
I fully agree with what my colleagues said. The first question we addressed today was, what are some of the benefits of digital healthcare over the traditional? But in a context like the one we're discussing now, even the paper-based, the traditional approach would probably not be feasible, depending on the severity of the security situation. As I mentioned earlier, I'm originally from Ethiopia. The last 2 years in Ethiopia, most of you, I'm sure all of you would probably know, one big region was in war with the federal government. And that region, before 2 years, had a fairly solid, robust healthcare system and good universities doing research. but the last 2 years, let alone do digital data collection, even paper-based was not possible. So honestly, I don't have much to add other than just really trying to avoid the problem first, try to or find a solution, a political solution or other solutions to make the context appropriate or conducive to collect data.
All right, Prof. Thank you so much. I would like to take this question from one of our French participants, Suzanne. She says, bonsoir, chers panélistes. Quels sont les points essentiels sur lesquels nous devons mettre l'accent lorsque nous collectons des données devant servir des problèmes économiquement sanitaires? I'll translate it for panelists, especially Justus and Joseph. Suzanne simply wants to find out what are the key points we need to focus on or we need to consider when collecting data for health economic reasons, for health economic issues, please. So what are some of the key points that we need to consider when collecting data for health economic issues? Justus, Wilfred, Joseph? 1 minute, please.
Okay, I can go first. I had typed that, but I think I can mention. So when you look at this question and what do we need to emphasize whenever we go to collect data, I believe we should be, again, results oriented. And when we collect the data, like the way we always like to say there should be values for money, here in this place, we should also say there should be value for that data. So when we collect the data, let us be accountable to the stakeholders where we got the data from and go back to them, show them how the data was used and how it has helped us to improve whatever situation we are trying to intervene in. Over.
Okay, thank you. I'll take this next question from an anonymous attendee. He says, digitalization requires a decision and commitments by a country. From your experience, has the Cameroonian government, I think this is directed to Wilfred, has the Cameroonian government committed to this? Is there any organ whose mandate this is? Wilfred, any idea, any thoughts?
Yeah, thank you very much. Yeah, I think Cameroon is currently using a digitalized system for healthcare. They call it the DHIS2, the District Health Information Software version 2, and a lot of African countries are using that. This system is used in collaboration with the paper-based system. So data is collected, aggregated on paper, and then typed into the system. Which the major advantage of this is that the data can be easily accessed by everyone at every level. So it's still a system that has the way the Cameroon government is using it. It's combined with the paper-based approach, but it's also possible in some situations to completely digitize the same platform that Cameroon, so to speak, is using in collaboration with the paper-based system. Thank you.
Great, thank you. Now, Gerald wants to find out. Hi, Vera, thanks for hosting this discussion. Thank you. Much appreciated. I am a founder of a healthcare software startup in Boya, and our software currently runs in several hospitals in the Southwest region. This is a self-funded project. Our software collects data in situ while it's being used. None of your panelists has highlighted the role that hospitals can play in the collection of such data. Any thoughts on this, please? Has any of our panelists come across this software that is being used in situ? Wilfred, Justus, Joseph?
Okay, you can go first on this.
Okay.
Yeah. We really appreciate, and it's not that we really don't highlight the role of hospitals in this discussion. Of course, we are looking at hospitals as the service delivery points, being at the center of all this. When we talk of healthcare, we would want to improve the life of the patients, life of whoever is seeking care. So these health facilities become very critical in all this data we collect. Moreover, they are the ones who interface with patients, and it's very important. They have a big role to play. And when it comes to the tools they use, yes, we had also highlighted funding of healthcare is from different sources, including private sector. We appreciate such efforts. This is common even in other countries. You realize some private stakeholders go on and innovate and fund such initiatives. That's very powerful, and we pray that at some point, maybe if it's necessary, you can seek for collaboration with the government and see how we all work together towards the same goal.
Thank you. So our last question for the day comes from Akam Foba. A lot of our healthcare data exists in silos. Data from NGOs, local NGOs, private and public health institutions are shared. What advice would panelists suggest for healthcare professionals looking to combine these silos to generate more accurate insights at regional and national level while respecting patient privacy?
Okay,
Any thoughts on that?
I can go first on that. It's a very important question, and we've appreciated that with the ongoing situation, governments are realizing the importance of digital tools. We've highlighted, or if we didn't highlight, it's also common to see governments trying to put in place interoperability platforms currently. I've seen various initiatives going on, but also to highlight at the continental level, we've also got the leadership of Africa Centers for Disease Control, which of recent has come on to really guide the digital direction for the continent. So there are ongoing initiatives, and we believe with time, all this integration will happen, where you will find actually data that is even well protected in the context of the security platforms and agreements that have been made between different countries. So there are various efforts that are ongoing, and of course with the leaderships of ministries of health, but also Africa CDC at the continent level.
Okay, thank you so much, Justus. And ladies and gentlemen, in the next couple of minutes, we should be rounding up with our discussion on data, a currency for evidence-based healthcare development, how to optimize the generation, collection, and exploitation of data. So this webinar is organized by the Dennis and Lenora Forita Foundation and is sponsored by Grand Challenge Canada as part of a project called the Bonfine, which is an innovative digital health solution to improve access and utilization of reproductive, maternal and child health services in low and middle income countries. So I want to say a very big thank you to our partners, Grand Challenge. We also want to say thank you to our dynamic panelists and our wonderful audience for all the interventions, questions, answers, and support we've had for this 1 hour, 28 minutes. So last thing I want to find out from our panelists, what is the take-home message in 30 seconds? Prof, Joseph, and Wilfred. 30 seconds, Prof, what is the take-home message from this webinar? Thank you.
The take-home for me is going back to the title. We need data. Data is critical. We need to generate evidence, and we need to do it well. So these three should go together. Data, as I said, is raw material. We need to process it optimally with the hope of practicing evidence-based healthcare.
Thank you so much. Justus, your take-home message in 30 seconds, please.
Yeah, in addition, I think as we emphasize collection and utilization of data, we also need to be accountable for the data that we say we need to collect. So when we collect the data, really we should get back to the stakeholders with what good have we got out of the data so that they appreciate the importance. And of course, this will always drive stakeholders' involvement in supporting the data generation and all the processes that Prof has talked about.
All right. Thank you so much, Justus. And Wilfred, 30 seconds. What's your take-home message?
Thank you very much. There is no evidence without data. And it is important to note that this data must be of good quality for this evidence or these decisions to make sense. As such, the processes of collecting this data, analyzing them, and using them must be done correctly. So there's need to have the right experts to do these processes. Thank you.
All right, thank you so much, gentlemen, and it's been a wonderful pleasure hosting this webinar. So I remain your humble host, Vera Kum.